The fluorescent lights of Riverside County Hospital's emergency room flickered as Dr. Margaret Chen, the chief of emergency medicine, glanced at her watch with visible irritation. It was 8:47 a.m. on a Tuesday morning, and the waiting room was filling with what she considered inappropriate cases, people who should have gone to urgent care clinics instead of clogging up her emergency department. Among the waiting patients sat a woman in worn clothing, her dark hair covered with a simple headscarf, quietly filling out admission forms with obvious difficulty. Margaret rolled her eyes at the sight. "Another one," she muttered to Nurse Jessica Ward, her longtime colleague who shared many of her views. "Probably doesn't even have insurance." From which city in the world are you watching this story unfold today? If tales of prejudice exposed and justice served resonate with you, consider subscribing for more stories where assumptions prove dangerously wrong. The woman in question was Dr. Elena Kovalenko, though no one in that hospital knew it yet. At 38, she was one of the CDC's most accomplished epidemiologists, with a PhD in infectious diseases and 15 years of field experience across 4 continents. Her worn clothing and hesitant manner were carefully calculated, part of an undercover operation investigating discrimination in rural healthcare facilities. For 3 weeks, she had been documenting how hospitals treated patients who appeared to be undocumented immigrants or refugees. Elena approached the reception desk, her accent thick and her English deliberately broken. "I need, doctor," she said slowly, clutching her stomach. "Very sick." The receptionist, a young woman named Ashley Cooper, barely looked up from her computer. "Do you have insurance?" she asked automatically, her tone suggesting she already knew the answer. Elena shook her head, producing a crumpled piece of paper with some writing on it. The receptionist sighed audibly. "You'll have to wait. We'll call a translator when one becomes available." Dr. Chen walked past, her designer heels clicking against the linoleum floor. She glanced at Elena with barely concealed disdain before addressing Ashley in a voice loud enough to carry. "Make sure you get her immigration status before we treat her. We can't afford to provide free healthcare to every person who walks through that door." Elena's expression remained neutral, but her hand moved subtly to the small recording device hidden in her jacket pocket. This was exactly the kind of violation she was documenting. In the waiting room, Elena sat beside a young mother with a feverish child and an elderly man clutching his chest. 2 hours passed. The elderly man was finally called back, but Elena remained waiting. She watched as Dr. Chen treated patients selectively, clearly prioritizing those with insurance cards and American accents. Nurse Ward brought forms to Elena 3 times, each time speaking slowly and loudly as if volume would overcome the language barrier. At 11:23 a.m., everything changed. A commotion erupted near the ambulance bay. Paramedics rushed in with the first of what would become 17 patients, all showing identical symptoms: severe nausea, difficulty breathing, and confusion. "They all ate at the same restaurant," one paramedic explained breathlessly to Dr. Chen. "Some kind of food poisoning, we think. But it's spreading fast." Dr. Chen sprang into action, her professionalism overriding her prejudices as she began triaging the incoming patients. Within 30 minutes, the emergency room was overwhelmed. Patients were vomiting, collapsing, and some were beginning to show signs of respiratory distress. "This isn't food poisoning," Dr. Chen told her team, her voice tight with concern. "This is something else." Elena had been watching the situation unfold with growing alarm. From her position in the waiting area, she observed the symptoms with professional clarity. The pattern was unmistakable: this wasn't bacterial or viral food poisoning. The rapid onset, the specific symptom cluster, the way patients were deteriorating, she had seen this before. This was chemical exposure, possibly organophosphate poisoning. And if she was right, the entire hospital was potentially at risk. She stood up and walked toward the nurse's station, her hesitant manner dropping away. "Excuse me," she said, her English suddenly fluent and precise. "I need to speak with the doctor in charge immediately. This is an emergency." Nurse Ward turned to her with annoyance. "Ma'am, you need to sit down. We'll call you when. Now, Elena interrupted, her voice carrying unexpected authority. Every minute counts. Those patients are showing signs of organophosphate exposure, not food poisoning. If I'm right, this hospital needs to be quarantined immediately. Dr. Chen, overhearing this, stormed over. Who do you think you are? She demanded. You can barely speak English, and now you're diagnosing patients. Security. Elena reached into her jacket and produced a badge and ID that made Dr. Chen's face drain of color. Dr. Elena Kovalenko, CDC Special Pathogen Branch. I'm federally authorized to take command of this situation under the Public Health Service Act. And as of this moment, this hospital is under quarantine protocol. The emergency room fell absolutely silent. Even the sounds of sick patients seemed to fade as everyone processed what they had just heard. The refugee patient who had been waiting for hours was actually a CDC epidemiologist. And she had just declared a quarantine. Dr. Chen's hands trembled as she looked at the credentials. This can't be, her voice trailed off as the implications sank in. Elena's expression was professional but cold. Dr. Chen, I need you to listen very carefully. Based on the symptom presentation, I believe these patients have been exposed to a toxic substance, specifically an organophosphate compound. This could be accidental contamination or something more serious. Either way, we need to initiate emergency protocols immediately. She pulled out her phone and made a call that connected within seconds. This is Dr. Kovalenko, badge number 74521. I'm declaring a level 3 biohazard quarantine at Riverside County Hospital. I need a full CDC response team here within 2 hours. She rattled off coordinates and situation details with crisp efficiency while Dr. Chen stood frozen. What happened next transformed the hospital. Elena took complete command, her 3 weeks of observation giving her intimate knowledge of the facility's layout and weaknesses. She directed staff to seal all exits, called for hazmat suits to be distributed, and began systematically testing the affected patients for specific toxins. Her expertise was evident in every decision, every protocol she implemented. Nurse Ward, who had treated her dismissively for hours, now followed her orders without question, though her face burned with shame. Dr. Chen tried to maintain some authority, but it was clear to everyone that she was no longer in charge. The CDC had federal jurisdiction, and Dr. Kovalenko's authority was absolute. As hazmat-suited CDC agents began arriving, Elena coordinated the response with practiced ease. She ordered blood tests, environmental sampling, and patient isolation. Within 90 minutes, her preliminary analysis was confirmed. The patients had been exposed to a pesticide that had contaminated the restaurant's water supply. It was serious but treatable if caught early, which Elena had done. Hospital Administrator Robert Morrison arrived, having been called from a meeting across town. His face was red with confusion and anger as he demanded to know what was happening. Elena met him in the sealed-off administration wing, her CDC credentials prominently displayed. Mr. Morrison, your hospital has been the subject of a federal investigation for the past 3 weeks. I've been documenting systematic discrimination against patients based on perceived immigration status, language barriers, and economic factors. She produced a tablet showing video and audio recordings from her time undercover. Morrison's face went from red to pale as he watched Dr. Chen's comments about free healthcare and immigration status. There were dozens of similar incidents, each one a clear violation of federal healthcare non-discrimination laws. But here's what you need to understand right now, Elena continued, her voice firm. If I hadn't been here today, if I hadn't been trained to recognize these symptoms, you would have had 17 deaths and possibly hundreds more exposures. Your staff misdiagnosed a chemical poisoning as food poisoning. That kind of mistake can devastate an entire community. The hospital's legal team was already scrambling. Within hours, state and federal health departments had descended on Riverside County Hospital. The investigation into the discrimination practices would be damning, but the immediate crisis was the chemical exposure, and Elena's quick action had prevented a catastrophe. Dr. Chen found herself in a conference room, facing Elena and a panel of hospital executives and federal investigators. For 3 weeks, Elena explained calmly, I documented how your emergency room treated patients differently based on appearance and language. You violated Title VI of the Civil Rights Act, the Emergency Medical Treatment and Labor Act, and numerous state healthcare regulations. She pulled up specific cases on her laptop. This man, she pointed to an image, waited 6 hours with chest pain because he spoke limited English. He had a heart attack in your waiting room. This woman was turned away entirely because she couldn't prove insurance. She had appendicitis. Your staff's prejudice could have killed her. Dr. Chen tried to defend herself. We were following proper procedures for patient intake. You were following discrimination protocols, Elena interrupted sharply. And you trained your staff to do the same. The recordings don't lie, Dr. Chen. Neither do the outcomes. The hospital administrator Morrison asked the question that was on everyone's mind. What happens now? Elena's expression softened slightly, but her voice remained firm. Now, we fix it. The CDC is recommending, actually, requiring, a complete overhaul of your patient intake procedures. You'll implement mandatory cultural competency training for all staff. You'll establish a patient advocate position to ensure non-English speakers receive equal treatment. And Dr. Chen, you will be temporarily removed from your position pending a full review. The room erupted. Dr. Chen stood abruptly, her face flushed with anger and humiliation. You can't do this. I've been chief of emergency medicine for 8 years. My record. Your record shows a pattern of discrimination that would have resulted in preventable deaths, Elena said quietly but firmly. Today's chemical exposure incident only highlighted what I've been documenting for weeks. You're a skilled physician, Dr. Chen, but you've been letting prejudice affect patient care. That's unacceptable. Over the next 6 hours, as the chemical exposure patients received treatment and began to stabilize, Elena coordinated not just the immediate medical response but also the long-term institutional changes. The CDC team she had brought in included not just epidemiologists but also healthcare equity specialists who began immediate training with hospital staff. Nurse Jessica Ward found herself in a small office with Elena and a federal mediator. I'm ashamed, Jessica admitted, tears streaming down her face. I never thought. I didn't realize we were actually hurting people. We just thought we were being efficient. Elena's expression was compassionate but direct. Efficiency can't come at the cost of human dignity, Nurse Ward. Every patient deserves respect and proper care, regardless of how they look or sound. The fact that you're recognizing this now means you can be part of the solution. By evening, all 17 poisoning victims were stable and receiving treatment. Elena's quick diagnosis had saved lives, including several hospital staff members who had been exposed while treating the initial patients without proper precautions. If she hadn't recognized the symptoms and initiated quarantine protocols, the contamination would have spread throughout the hospital. The local news had picked up the story, though the details were carefully controlled. A CDC specialist helped avert a major health crisis at Riverside County Hospital today, the anchor reported. Dr. Elena Kovalenko identified a chemical exposure that local staff had initially misdiagnosed, potentially saving dozens of lives. What the news didn't immediately report was the discrimination investigation, but that would come. Federal investigators were already interviewing former patients, many of whom shared stories of being dismissed, delayed, or denied care based on their appearance or language skills. That night, Elena sat in a temporary office the hospital had provided, writing her preliminary report. The door opened, and Robert Morrison entered, looking exhausted and defeated. Dr. Kovalenko, he began hesitantly, I want you to know, we're grateful. For what you did today. The poisoning response, Elena nodded acknowledgement. Mr. Morrison, I need you to understand something. I didn't go undercover here to hurt your hospital. I came because we'd received multiple complaints about discrimination in care. Today proved why this matters. When staff make assumptions based on prejudice, they miss critical information. Your team dismissed me as incompetent because of how I looked and sounded. Imagine if I hadn't been here. Imagine if those 17 patients had been treated by staff who were too busy judging to properly diagnose. Morrison sank into a chair. What can we do to fix this? Everything, Elena replied simply. And you're going to start tomorrow. 3 months later, Riverside County Hospital looked very different. The changes Elena had mandated were now fully implemented. Signs throughout the hospital appeared in multiple languages. A new patient advocacy office handled concerns about discrimination. Every staff member had completed intensive cultural competency training, and those who refused were no longer employed there. Dr. Chen had been replaced as Chief of Emergency Medicine. After months of additional training and reflection, she now worked under the new chief, Dr. Rajesh Patel, learning to recognize and challenge her own biases. It was humbling work, but she was gradually becoming a better physician for it. Nurse Jessica Ward had become one of the hospital's strongest advocates for equitable care. She led training sessions for new staff, using her own experience as a cautionary tale. I was so focused on efficiency that I forgot about humanity, she told each new group of nurses. Don't make my mistake. Elena returned to Riverside County Hospital for the formal unveiling of new policies. The hospital auditorium was packed with staff, community members, and media. Robert Morrison stood at the podium, his voice steady and sincere. 3 months ago, a federal investigator showed us some uncomfortable truths about how we were treating our most vulnerable patients. Today, I'm proud to announce that Riverside County Hospital has become a model for healthcare equity. He gestured to Elena, who joined him on stage. Dr. Kovalenko didn't just expose our failures, she gave us a roadmap to do better. And in the process, she saved 17 lives by recognizing a crisis that we had completely missed. Elena addressed the crowd with characteristic directness. Prejudice isn't just morally wrong, it's medically dangerous. When healthcare providers make assumptions based on appearance, language, or economic status, they miss symptoms, delay treatment, and sometimes let patients die. She paused, letting that sink in. This hospital has done hard work over the past 3 months. But this isn't finished work. Creating truly equitable healthcare requires constant vigilance and constant effort. The CDC had compiled the Riverside County case into a national training program. Hospitals across the country were now using Elena's recordings and the subsequent transformation as examples of both the problem and the solution. The video of Dr. Chen's dismissive comments had been particularly impactful, showing physicians in training exactly how unconscious bias manifests in medical settings. The pesticide contamination incident had led to its own set of reforms. The restaurant's water supply had been contaminated by agricultural runoff, a problem affecting dozens of rural communities. Elena's rapid response had not only saved lives that day but also triggered inspections that protected thousands more people. On her last day at Riverside County Hospital before returning to CDC headquarters, Elena walked through the emergency room one final time. The waiting area was diverse, people of different backgrounds, languages, and economic situations, and all were being treated with equal respect and efficiency. A woman in a headscarf was speaking with a nurse through a professional interpreter, receiving the same attention as the businessman beside her with excellent insurance. Dr. Patel found Elena near the entrance. Dr. Kovalenko, I wanted to thank you personally. Before you came, I was interviewing for this position, and I could feel the resistance. Some staff didn't think I should be chief because of my accent, my background. Now, things are different. Elena smiled. Dr. Patel, you were always the most qualified candidate. The only thing that changed was that people finally saw that. She gestured to the bustling emergency room. This is what healthcare should look like, professionals focused on patient needs, not patient appearance. As she drove away from Riverside County Hospital, Elena's phone rang. It was her supervisor at the CDC. Elena, we need you for another investigation. There's a nursing home in Oregon with similar complaints about discrimination. Elena smiled slightly, already mentally preparing for her next undercover role. "Send me the details," she replied. "Let's find out what's really happening there." The Riverside County case became a landmark in healthcare equity enforcement. The hospital's transformation was featured in medical journals, the staff's training program was adopted by hundreds of facilities, and Dr. Chen's journey from prejudice to awareness became a case study in professional growth and redemption. But perhaps the most lasting impact was on the community itself. Patients who had previously avoided the hospital, fearing discrimination or mistreatment, began returning. Trust was slowly being rebuilt. And every time a new patient walked through those doors, they were met with a system that had learned a painful but crucial lesson: in healthcare, prejudice doesn't just hurt feelings, it costs lives. 5 years after the quarantine incident, Elena received an invitation to speak at Riverside County Hospital's annual Healthcare Equity Conference. The hospital had become a national leader in inclusive care, and they wanted to honor the person who had forced them to confront their failures. Standing before an audience of healthcare professionals from across the country, Elena shared the full story for the first time publicly. "For 3 weeks, I pretended to be a vulnerable immigrant patient," she explained. "I experienced dismissal, delay, and discrimination firsthand. It was degrading, frustrating, and frightening, and I knew at any moment I could reveal my credentials and make it stop. The real patients you treat every day don't have that option." She clicked to a slide showing Dr. Chen, now an assistant professor of emergency medicine at a university hospital, teaching cultural competency to medical students. "This physician made serious mistakes," Elena said. "But she also made the choice to grow, to learn, and to change. That's what institutional change looks like, acknowledging failures and committing to constant improvement." The conference audience included several of the 17 poisoning victims Elena had helped save 5 years earlier. One of them, a young teacher named Maria Gonzalez, stood to speak during the Q&A session. "Dr. Kovalenko, you saved my life twice that day. Once by recognizing the poisoning, and once by forcing this hospital to see people like me as deserving of excellent care. Thank you." As the conference concluded, Elena reflected on her years of undercover investigations. She had exposed discrimination in hospitals, clinics, nursing homes, and rehabilitation centers across the country. Each case had sparked change, but each case had also revealed how deeply prejudice could embed itself in institutions meant to serve everyone. That evening, as Elena prepared to fly back to Atlanta, she received a message from Nurse Jessica Ward. The photo attached showed Jessica receiving an award for patient advocacy, recognition of her transformation from someone who had participated in discrimination to someone who actively fought against it. The message read simply, "Thank you for not giving up on us. You showed us we could be better." Elena smiled and typed a response, "You did the hard work. Never stop questioning, never stop improving." The story of the refugee who became the commander, of the dismissed patient who was actually the expert, had become more than just a tale of dramatic reversal. It had become a blueprint for how institutions could confront their own prejudices and emerge stronger, more effective, and more humane. 10 years after the quarantine, Riverside County Hospital's emergency room bore a plaque near the entrance. It showed no names, just a simple message: every patient deserves dignity, respect, and excellent care, regardless of appearance, language, or circumstance. Below it, in smaller letters, "We learned this the hard way. We will never forget it." And across the country, in emergency rooms, clinics, and hospitals, that lesson continued to spread: one changed mind, one reformed policy, one saved life at a time. Have you ever been dismissed because of how you looked or sounded? Have you witnessed someone else being treated as less than human because of prejudice? The woman in that waiting room spent 3 weeks documenting how assumptions can literally cost lives. And when she finally revealed her true identity, she didn't just expose one hospital's failures, she sparked a movement that changed healthcare for millions.